Radiation therapy of the chest is a common treatment option for breast cancer and melanoma cancer. Radiation typically occurs after surgery, and there are a few things that you can do prior to help you feel more prepared, and during and after so that you can help keep your skin healthy and your shoulders and your chest pain-free. My name is Kelly and I'm a physical therapist, and I specialize in oncology and lymphedema as well as women's health. And in this video, I'm going to share the tips that I typically give my patients before, during, and after radiation treatment. So the number one thing that I see patients for is their range of motion. So if you just had surgery and you're still pretty tight, you're not going to be able to get into the position for radiation. Most of the time you will have to be with your arms up overhead for an extended period of time. And if you're still tight and sore in your chest area, you're not going to be able to get up there, or you're not going to be able to tolerate that for very long. So when we're talking about before radiation, we'll work on your range of motion by giving you gentle stretches. The stretches need to focus on your pec muscles as well as maybe your lat muscle or your pec minor on the side. Typically, a mold or a bolster is created for you to help support you with your arms overhead. But again, you need to be able to hold this for 5 minutes up to 30 depending on the person. Also, besides the issues that come after surgery with the tightness, some people will also get something like axillary web syndrome or cording, which can cause tightness and you're unable to lift the arm overhead. I have created a video on how to help get rid of cording after surgery, and I'll put a link for that down below or up above here. So let me show you my favorite couple exercises. So the first simple one will be on your back. You'll have your hands clasped behind your head or your neck and your elbows pointing upward. You'll gently allow your elbows to fall out to the sides until you feel a mild to moderate stretch across your chest. In this position, take a deep breath, allowing your ribcage and chest to expand, and then as you let your breath go, gently sink further into the stretch. Hold this for about 5 seconds and gently come back out. And you can repeat that 3 to 5 times. Another stretch that I love is a wall walk, so you want to be able to get high above your head for radiation. So standing at a wall or in a doorway, put your hand on the wall and slowly climb your hand up the wall until you feel that mild to moderate stretch underneath your armpit or on the side of your chest. You can take a deep breath in this position, and when you let your breath go, gently sink further into the stretch. Hold for about 5-10 seconds and gently come out of that. If you have any shoulder pain during that time or any pinching, make sure you scale back or bring your elbow a little bit lower. My favorite stretch is going to be a sideline pec stretch. So, laying on your side with your hands clasped behind your head and your elbow pointing forward, you're going to gently rotate open till you try to point the elbow to the wall behind you, or until you feel that mild to moderate pull across your chest. You can add that deep breath, feeling your ribcage and chest expand, and when you let your breath go, gently sink further into the stretch. Hold this for about 5 seconds, and then gently come all the way back out. You can repeat that 3 to 5 times, and do that in the morning, the middle of the day, and the evening. And I have created a video on the top 8 stretches for the pec area after surgery or after radiation, and I'll place a link for that down below or up above if you want more stretching ideas. The next major thing that we talk about is skincare. Typically, your radiation oncology team will give you a special cream or lotion to help put on over your radiated area. If your radiation oncology team does not give you a cream or lotion, let's talk about what ones would be the best for you. You want to make sure that you pick one up that does not have a lot of perfumes or a lot of extra chemicals in it, because that can really irritate that radiated area. So one of the most popular ones that I typically use is something like Vanicream. It is a little bit thicker, but it's not too sticky. Other ones like Aquaphor or Eucerin are also really popular. A popular one that you can find online is Bass Farms Triple B Hydrating Cream, or a lot of women and men will just use something like coconut oil. You want to make sure that you're hydrating this area, because because it's kind of like a sunburn that it will dry up the area and you may peel or blister a little bit. So something that keeps the moisture in can help soothe that. So a less spoken about but new and upcoming area of research is using vitamin E and pentoxifylline to help prevent radiation fibrosis. I'll put the links down below for some of these small studies, but the research is showing that the use of vitamin E and pentoxifylline for about 6 months up to a year and a half after the radiation can help decrease the effects from radiation with that scar tissue or that fibrosis. I'm seeing more and more doctors prescribe vitamin E and pentoxifylline for their patients after radiation, but I'm also seeing doctors encourage or have patients try a topical or off-the-shelf vitamin E oil. Vitamin E is typically used over scars. It's known to help soften the scars and soften the tissue, and it is thought to do the same thing with radiation fibrosis. And so a lot of people will use with their creams or oils to help keep the area healthy and clean after radiation. They'll also do a vitamin E oil on the top to help with that healing process. The vitamin E oil is going to keep a moisturized barrier over the area, and that's going to help allow with the healing process to keep the skin more supple. You always want to make sure you check with your doctor before using the vitamin E oil, but I will put some links down below where you can find the topical off-the-shelf version that don't have a ton of the other fillers and chemicals in it. The next major thing you want to make sure you do is avoid the sun, especially during and after radiation. If you've had a sunburn before, then you know that sun exposure can be really irritating to the area. So when you go out, make sure you cover up with proper clothing and make sure that you apply sunscreen. The best ones to find are the ones with zinc oxide and a minimum of 30 SPF. That'll help protect your skin short term, but also for long-term skin health. A popular one, or one that I tend to love the most, is something like Badger sunscreen, and I will put a link for that down below. So another major tip that I have for my patients is to stay active. If your doctor clears you, exercise during and after radiation treatment can really help ease side effects such as fatigue. Fatigue is really common. It typically starts to pick up about halfway through radiation for most people, and for a lot, it will last about 4 weeks after radiation is done because you are still healing. Exercise can also help keep fluid moving out of the area of your arm or your chest wall to help decrease your risk for lymphedema. If you do see any increase in swelling, this may be normal. Radiation can cause swelling of the chest wall. It doesn't necessarily mean that it is lymphedema. But if you do have swelling, be sure to let your doctor or your lymphedema therapist know so they can look at it and give you proper compression or treatment if needed. Typically, exercise during this time will be light, such as walking or biking, and you will probably avoid swimming pools due to the chlorination likely irritating the skin. So the major side effects from radiation are tightness, which can be helped by stretching, skin breakdown, which can be helped with special lotions, moisturizers, and sunscreen care, and fatigue or light swelling, which can be helped with exercise. The other major component or long-term side effect of radiation is radiation fibrosis. Radiation fibrosis is a scar tissue-like buildup of the tissues in the radiated area due to the healing process. I am going to do a whole nother video on radiation fibrosis, which can cause more tightness, thickening, stiffness that people will have 3 months out, 1 year out, and beyond. And I will go more in depth on how to treat this. So if that's something you want to learn more about, make sure you press the subscribe button down below so you can be notified when that video comes out. If you found this video helpful, please press the like button, and I'll see you all next week. Thanks, everyone.